Hi, my diamonds, we're back again. So, oh look, you didn't take that out. Are you going to send it back?
No.
You need to take it out.
Okay.
Yeah.
One problem solved.
One problem solved, yeah.
Okay, fine.
Hi, my diamonds, we're back again. This is Fina and Tar. So we've come back with our good deeds, our good news. It's not really good news.
Well, it's easy if you get it right. If you intervene,
yeah.
It's great news.
Yeah, but if they don't,
yeah, then it's not good news.
That would be double wahala.
Yeah, we're back to Wahala. Yeah.
You will go back to double wahala. Hi, my diamonds, this is your girl Phinadiamond, and Tata is back again to do what he knows how to do best, to help us. So this is our third video, right?
Correct.
We've done the first one is on choking, and the second one is on.
We did assessment of an unconscious casualty, I believe.
Yeah, and then something intervention.
No, it was just managing the airways and checking for breathing.
Yeah.
And then they found that the casualty is breathing, hopefully.
Yeah. Yeah.
So we didn't move on to CPR. That's a future video.
Yeah, so we're going to do that. So we've done 2 videos already. If you can please check the 2 videos out in my channel, you will get the 2 videos, and this is the 3rd one he's doing. So today Ta is just going to, we're trying as much as we can to keep this video short for we all to understand. We don't want to make it up to like 20 minutes. We just want to keep it short so everyone can understand, and then we keep pushing it like that. But it would be nice if you all comment, comment, let us know what you think about the video, and it will harm if you like. And subscribing is free, liking is free. Just help us feel like you understand what we're saying. And not just me, help Ta know that what he's saying is right, is what we need. Yeah? I hope I've passed my message. Back to Ta and let him carry on doing what he knows how to do best. Thanks, Ta, for coming.
Hello, everybody. I often get the comment that people wish that first aid was taught in all schools. So I'm not sure that we can wait for that or wait for the quality of material to come across. Maybe it will happen one day, but hopefully. You've got all you diamonds out there to take on board the message and pass it on. And also, if there's anybody out there that is first aid qualified, here's a bit of revision and perhaps a bit of international comparison as to how the differences are in various regions or parts of the world, or similarities indeed. So today what I thought we would do is look at an unconscious breathing casualty, and we're going to go through head to toe check. We're going to divide it into 2 parts. So remember last week, if you've been following the videos in order, we checked danger, response, airways, breathing. So now if your casualty is breathing, you could pick up the phone and say, I need help, and they will say what's happened, what's wrong with the person, and you can say unconscious breathing casualty. Those of you that know the situation with the ambulance service will have experience of their call priority system. So maybe unconscious breathing casualty is not a priority. If you've got more detail, it might just help you get that priority. So that comment is actually targeted at the ambulance service here, but worldwide your skills are valuable or as valuable as the medics. If you keep your patient going, the medics have something to do. If you let the patient go, the medics have nothing to do. So we're helping you to help the systems wherever you are in the world. Yeah. So let's, without hesitation, get on with head to toe check. You should have gloves on. You should be wearing your PPE. You'd be amazed at the number of people that tell me PPI, that's payment protection insurance. I don't know how they're even going to wear that, yeah? But that's like Wahala Land, isn't it? Wow. So please don't wear PPI, wear PPE.
Yeah, the difference, PPE, not PPR.
Yeah, this is why I get on so well with my students. They come up with the most wonderful things. So you're wearing your gloves and you're going to examine their head. So you've got an unconscious casualty, you don't know what's going on for them, you're trying to find out. Don't just look at the head. Move the hair, look at the skin on the scalp. If there's any damage to the skin on the scalp, you are going to consider that a critical incident unless the history of the accident tells you otherwise. So we want you taking even the smallest of injuries, even when it's not bleeding out furiously. In fact, it might not be bleeding out at all. All the bleeding might be going on underneath. Okay, we want you to be taking that seriously. So 2 hands. Why? Because it's faster and we can compare. So if you can see, my hands are on the head, feeling around the head, having a good look. At the same time, I will be looking at the face. So if their face is pale, ruling out the amount of makeup they've got on, so if they're looking pale in the face, that could be poor circulation. If they're starting to turn blue, that's lack of oxygen. And if they're turning red, that could be a nervous system injury. It could be they've just finished one of the diamond warm-ups. It could be that they've got carbon monoxide poisoning, or they really like their drink. Yeah, that's so the body is telling you and communicating with you as to what's going on for the person. It's giving you little clues. If you can interpret those little clues, it could really, really, really help your casualty. Open the eyes, look in the eyes. If the pupils are the same size, problem is in the body. If one is big and one is small, problem is in the brain. So you've even found out at a glance whether the problem is in the body or in the brain. There are, if you do advanced training or you actually go on a course, you will learn about people that don't fall within that set of rules. Check the nose. Why would there be blood from the nose? Could they bump their nose? We're not immediately going to get dramatic, but if you see blood and clear fluid, that's indicated that there may be a skull fracture. So blood and clear fluid from the nose or ears could be indicator of a skull fracture. If we see just blood, well, that could be a nosebleed or an ear infection. We investigate the type of blood and its consistency to establish what we're actually supposing is wrong with the person. So
if the blood coming out from the nose is consistent, what would that be?
Well, it could be they bump their nose. Most common cause of nosebleed in many places is nose picking. Person need new hobbies.
Picking your nose can cause nosebleed?
Yeah.
Really?
Yeah. People need to
know. How can someone pick their nose to the extent of them start bleeding?
Why do people have that much time to pick their nose so frequently? It might be another question, but...
no, let's leave that. Carry on.
Maybe
let's not talk about that.
So we've checked the ears also, as well as the nose picking. They pick their ears as well with screwdrivers. And so, you know, when you say to people, are your screws loose? Well, maybe. Because that causes the injury, and ear injuries are particularly hazardous because it's a good access route for microorganisms, and some of them causing very nasty illnesses, meningitis, septicemia. So you have to be very careful with ear canal injuries. Now, I'm not telling you about intervention, but just a little side note that you're never going to put any dressings in the ear. So you've checked the ears, now you're going to check the mouth. They might have bit their tongue, they might have lost a tooth, they might have a gum infection. That's why there's blood in the mouth. Okay. If they're coughing and there's frothy blood, that potentially is a lung injury. If there's vomit and blood, that's a stomach injury. Okay. So you look for where is this blood coming from. Now, it's useful to have a knowledge of anatomy because people keep telling me that their stomach is, well, they put their hand where their bladder typically is and they think their stomach's there. If your stomach is in your bladder, well, you have urgent medical needs is all I can tell you. So just be aware of what you're supposing and what's going on.
How can someone's stomach be in their bladder?
Yeah, exactly. But people all day, every day, sort of
they come up with something.
Stomachache. Well, that's interesting because your stomach's just not there. Okay. So have a little Google on anatomy books, upper left side, stomach and spleen. So if you rupture your spleen, upper left abdominal, you're in heaps of trouble. Okay. So splenectomy is considered to be a life-threatening injury, and survival chances are not deemed to be fantastic. People do survive a splenectomy providing they get help quickly, but you know that casualties in big trouble. Opposite side is the liver. As you know, liver has many functions, so If we see bruising around that area or bleeding around that area, we're quite concerned for that casualty. Okay. Round the back of the kidneys. Now, people who have been hit in the back and maybe they're bleeding internally, they might ask you to go to the toilet. Don't let them go to the toilet. Anybody with injury between here and here, upper thigh, so belly button, upper thigh, if they're asking for the toilet, no. Their bladder might be full of blood, so once they start releasing that blood, it could be a problem to stop that. Okay. Also, look for bruising around the chest, because obviously you're concerned about the heart. So as we go through, we'll be looking for that. After the mouth, we're checking the neck for any stiffness or tension. Classic signs of a neck injury, spinal injury. There might be stiffness or tension, or crunchy noises, or bleed, or burn. So all the way through this assessment, you're looking for lumps and bumps and bruising and swelling and bleeding and rashes and burns and bones sticking out. Anything that's abnormal. So if it's not normal, you're concerned about it. But you finish the head to toe check before you're making your decision, so you can think about what's the most serious thing and what's the least serious. So we check neck, shoulders, spine. So after you've learned to sit and crawl, there's a gap between your lower back and the floor. When I've got somebody lying on the floor, then I'm expected to find that gap. If that gap is not there, I'm thinking that they've got serious spinal injury. So check for the gap between the lower back and the floor. Slide your hands up and down the back, look for bleeding and all the other things that I mentioned. And then we look at the chest. So we actually expose the chest and expose the parts that we're looking at, so that we can establish what injuries there are. You do have to consider the rules in your society and in your culture and in your country. So have a think about that. But particularly with chest injuries, if I spot a chest injury on the right and I turn the patient to their right, I'll be saving their life. If I leave their clothes on, I might not spot that chest injury. Yeah. You can always put clothing back after you've assessed the person. If they've got chest injury on their left, it's better to put the casualty on their left. Yeah. Okay, and then you stop the other lung from becoming contaminated with blood. Yeah. So after you've checked the chest, you're going to look at the abdomen. It might be the intestines are sticking out. So our body is very, very tightly packed. It's a very tight network. So if I took your blood vessels end to end, we could go around the planet more than twice. Yeah. So that's how much content there is in the body. It's sort of more content than some people's social media feed, isn't it? So we've checked the chest. Now we're going to check the abdomen. So if it's smaller abdomen, we compare right with left. If it's a bigger abdomen, we're comparing upper right with upper left, and then lower right with lower left. Notice I'm sliding my hands all the way across, again looking for any abnormalities, any protrusions. If we do see a protrusion, we're not going to try to replace it. You're not doing surgery out in the street. You leave that for the professionals. Okay, and also don't tell them your favourite jokes. If they've got intestines poking through, you might get to meet and greet those intestines a bit more than you wanted. So we've got to the abdomen, then we come back and check breathing, and that will be my stopping point, and then there will be a part 2 next time to tell you where you go from your second breathing check. So your first breathing check was when you did your initial assessment, and then halfway through this you do a second breathing check. And don't worry, that assessment, the entire assessment, takes 60 seconds. It's just taking me a bit longer, where I'm taking the time to tell you.
Yeah, so they can understand it properly.
Doing. Yeah. Okay. Thank you for listening. I hope you found that useful. I hope if you've got someone around you that's unwell, you can have a look, and maybe you spot that rash or that problem that will encourage you to alert the emergency services, and you can celebrate a great, timely intervention. Nice to see you again. Please comment and ask questions. I'm looking forward to your questions, and as we receive them, we will discuss them on our next video. Yeah. Thank you.
Yeah. So yeah, thank you so much. Thank you.
You're very welcome.
Thank you. At least now we know what to do. You know, if someone has got injury on the chest, depending on what side of the chest, you know what to do. So these things are really good, because you know when to call ambulance. At least before the ambulance will come, you know what to do to help before you have external help. So I don't know how to say please. I can't be begging for you to do what is right for you. So just do the right thing. Like it, comment. When you comment, it opens it up for other people to see. But when you just watch and you don't like, you don't comment, other people won't see. It will just be in the little circle where it is right now. So please, we are begging you guys to please comment, share the video so that other people can see it. We're just talking about saving lives. You don't know when it will happen, and you don't know who you can save. So don't just look at the video and go, oh, what's this two talking about? Why is this two always there saying shit? We're not saying, I just said shit.
Yeah, don't say that.
No, seriously, I'm still going to say, we're not saying shit, but we're trying to save lives. And I've told you people when we did the first video why I am doing this. Ta knows how important this is to me. Like seriously, if I have, just imagine those 4 officers that was in the car with my brother.
Yeah.
Just imagine if they've watched this. What would have happened?
Completely
now they know what to do. And even if finally he passed away, they can tell you, oh, we tried this, we tried that, but it didn't work. Then it will give you that satisfaction knowing that someone tried, but yeah, he went. But me knowing that they didn't try, they went on boxing him, just made me think like, and when I watched the video of him lying down, when they put him in the back of the truck, taking him to the mortuary. When I saw him there, I was like, no, he's unconscious, like he's not gone. But there's nothing I can do, he's gone. So imagine them knowing that. That would have saved. Even one of them messaged me yesterday to say, oh sis, it's been a long while. And when he messaged me, that thought just came back again. Yeah. So yeah, please. I know why I'm really pushing this. Like seriously, I don't know how to thank Tar. Like, you guys have to help me. For him coming here to do this every day, even if it's just one person that watched the video, I am fine with it. I am really fine knowing that at least someone watched the video. Last time we did the video, a few people comments, and they said how helpful that was with them. Yep. And the one we did last time, someone commented and she said, oh, that was really needful because she's got little ones at home. So yeah, don't just watch videos and go, you know what, yeah, that's it. Try and pick this ring. Try and pick one or two from any video that we're doing, and mainly any video that you see me doing with Tar. Try and pick one or two. Like seriously, I can't stop saying this. I don't know why he's helping me, but if you know how many years that Tar has put into this work, and from his experience, guys, you can see how he's explaining this. This is not just like, oh, okay, let me look this back. Everything is in here. So Tar is talking from experience. He's giving us this for free from experience. So if you want to make use of it, if you don't want to make use of it, there's this part in my country, they said, Owolo Komimbe. That means it's not my problem, it's not my business. So Owolo Komimbe. Pick whatever you want. So we're going to leave you all here and hope to catch you all in our next video. Thank you so much for watching, and please don't forget to subscribe, like and share, and we will see you again.
Yeah, have a great time.
Same here. Yeah, you did well.